Most oral surgery requires a local anesthetic which numbs the surgical site and surrounding areas. Numbness usually wears off within 24 hours, but may last longer in areas surrounding the surgical site. Be careful not to bite your cheek or tongue. If numbness persists, please call our office. A slight post-operation fever is common. Tylenol or ibuprofen can help reduce the fever. If the fever lasts more than 24 hours, please call our office immediately. You may experience cracked, dry lips, which sometimes occurs due to the corners of the mouth being stretched during the procedure. Lip ointment can help relieve this condition. Bleeding and oozing are normal up to 24 hours. Gauze placed at the surgical site must be checked every 45 minutes for the first 4 to 6 hours. If bleeding persists, place gauze soaked in ice water or a tea bag to the surgical site and bite down to expedite clotting. If bleeding persists or you have unusual drainage, please call our office immediately. You will experience swelling and bruising after oral surgery. Swelling typically increases until the 3rd postoperative day and can last up to 14 days after surgery. Place an ice pack over the surgical site for 20 minutes at a time, with 10 to 20-minute rest periods. After 24 hours, ice has no beneficial effect. For the first 2 days, sleep with your head elevated at 30 degrees to minimize swelling. For bruising, apply moist heat to the bruised area. Stitches are often used in oral surgery. These are usually reabsorbable and will fall out on their own within the first 5 to 7 days. If sutures that require removal are placed, you will be notified by your surgeon. You may feel sharp edges near the surgical site. These edges are usually the bony walls that supported the teeth or the sutures. Occasionally, bone fragments may work themselves out during the first week or 2 and will be removed at your first post-op visit. You may experience a sore throat or ear pain when swallowing for the first 2 to 3 days following surgery, due to the swelling of the muscles of your throat. Stiffness of the jaw muscles may cause difficulty in opening your mouth for a few days following surgery. Both of these will resolve in time. You will be prescribed appropriate pain medication and the proper prescription or over-the-counter anti-inflammatory medication. It's best to take your pain medication before the local anesthetic wears off. Do not drive or operate a motor vehicle after taking your pain medication. If you experience itching while taking pain medication, please call our office immediately. Taking pain medication on an empty stomach can lead to nausea. Nausea can occur after surgery if you are sedated during the procedure and from pain medications. Reduce nausea symptoms by eating small amounts of food, drinking clear liquids, and avoiding pain medications. Benadryl can also decrease postoperative nausea. If nausea persists excessively, please call our office immediately. Do not disrupt the surgical site. You can begin brushing your teeth again the day after your surgery. Small amounts of bleeding are normal when brushing, for the first week after surgery. No rinsing of the mouth should be performed for the first 12 hours after surgery. After that, it's important to rinse the surgical site very gently with warm salt water after meals. Do not smoke, suck through a straw, or use the irrigation syringe for the first week after surgery. Negative pressure or irrigation of the surgical site can remove clotting, which is called dry socket. Additionally, nicotine is detrimental to the healing process. Do not use commercial mouthwash or disinfectants unless prescribed by your surgeon. You are encouraged to eat as soon as possible after surgery, beginning with clear liquids such as water or apple juice, and advancing as tolerated. Soft cold foods like ice cream, pudding, and applesauce are recommended the first day. Soft warm foods like mashed potatoes, pastas, and soups can be introduced the following day. Do not eat hard, sharp foods like chips, nuts, or seeds, as these may be lodged into the surgical site. Plan to rest on the day of your surgery. Be careful and stand up slowly, as decreased fluid intake and pain medication can cause dizziness. Decreased calorie intake will also require you to reduce the intensity of your exercise routine during the healing process. If you become lightheaded while exercising, stop immediately, then lie down and rest. Avoid any activity or sport that may expose you to a blow to the mouth or jaw.